In more than 35 years of caring for older adults, I've seen families lose loved ones from something they never imagined could happen at an ordinary dinner table. And almost every time, they tell me the same thing. He was eating normally, then suddenly something changed. Most people think choking always looks dramatic, but in older adults, it often doesn't. Sometimes the warning signs are so quiet that everyone at the table misses them. Today I'm going to show you 4 warning signs that someone may be silently choking while eating, including the final sign, the one most families mistake for something completely harmless. I want to be very clear before we begin. Seeing one of these signs does not automatically mean someone is choking. Many of them have harmless explanations, and I'll walk you through those too. But recognizing these patterns quickly can sometimes save a life. And that's why I wanted to sit down and talk with you about this today. I'm Dr. Alan Mercer, and I've spent my career in family medicine, sitting across the desk from patients just like you and just like your parents. So let's talk about the first sign, because it's one that catches families completely off guard. The first sign is a sudden inability to speak while eating. Now, we all pause mid-sentence sometimes when we're chewing. That's normal. What I'm talking about is different. It's a person who was talking a moment ago, mid-conversation, and then suddenly, nothing. You ask them a question, and they don't answer. Not because they didn't hear you, because they physically cannot make a sound. Their mouth may open, their eyes may widen, but no words come out. Here's why this happens. Speaking requires air moving past your vocal cords. If something is blocking your airway, even partially, that air simply can't get through the way it needs to, and the voice goes quiet. In many cases, someone who suddenly stops talking is just startled, or has a bit of food caught awkwardly, and it resolves within a few seconds on its own. That's the harmless version, and it's the most common one. But there's a pattern I've learned to watch for over the years. If someone stops speaking suddenly and they also look distressed, or they don't recover within several seconds, that's when it becomes concerning. I remember a patient of mine, Robert, 78 years old, sharp as anyone I knew. His daughter told me about a Sunday dinner where, mid-story, Robert just stopped. His mouth was open, but nothing came out. For a moment, the family thought he was just pausing for effect, the way he sometimes did when telling one of his stories. But his daughter noticed his eyes weren't playful anymore. They were wide, almost searching. She called his name, and he didn't respond because he couldn't. That instinct, to look closer instead of laughing it off, made all the difference in how quickly they got him help. Now, let's talk about the second sign, because this one is often mistaken for something completely ordinary. The second sign is repeated coughing, or a cough that sounds weak and ineffective during meals. Coughing, believe it or not, is one of the body's best protective reflexes. When a small piece of food or a bit of liquid heads toward the airway instead of the esophagus, a strong, forceful cough is often the body's way of clearing it out before it becomes a problem. That kind of cough, loud, sudden, effective, is usually a good sign. It means the airway is doing its job. What worries me more is the opposite. A cough that sounds weak, breathy, or repetitive without actually clearing anything. It's the difference between someone clearing their throat with a firm, single cough and someone who coughs softly again and again without relief. That weaker pattern can sometimes be a sign that the airway isn't being cleared effectively, and in older adults, this is sometimes associated with a condition called aspiration, which simply means that food, liquid, or saliva is entering the airway instead of the swallowing tube. I want to be careful here because a lot of things can cause coughing during meals that have nothing to do with choking. Acid reflux, a scratchy throat, even eating too quickly can all cause a cough. This is not something to panic over every single time it happens. But I think of my patient Walter, 81, who had a series of small coughing spells during meals over the course of a few weeks. His wife mentioned it to me almost in passing, like it wasn't a big deal. "He just coughs a little when he eats now," she said. When we looked closer, we found that Walter's swallowing muscles had weakened slightly, something that can happen gradually with age, and it was allowing tiny amounts of food to travel toward his airway instead of his stomach. It wasn't dramatic, it wasn't an emergency in the moment, but it was worth catching, worth evaluating, and worth adjusting his diet and swallowing technique for, because left unaddressed, that kind of pattern can sometimes lead to more serious problems down the road, including a type of pneumonia caused by food entering the lungs. Now here's the warning sign most people completely miss, because it doesn't look like what we expect choking to look like at all. The third sign is watery eyes, a hand suddenly reaching toward the throat, or an unusual, almost blank expression on someone's face during a meal. This is where I think Hollywood has done us a disservice. In the movies, choking looks loud. People clutch their throats dramatically, they gasp, they knock over chairs. In real life, especially in older adults, it can look almost peaceful from across the table, which is exactly what makes it so dangerous. Here's why. When someone's airway is blocked, they cannot call out for help, because calling out requires moving air past the vocal cords, and that air isn't available. So instead of shouting, you might see someone's eyes suddenly water without any obvious reason. You might see a hand rise instinctively to the throat, sometimes referred to in medicine as the universal choking sign. You might notice a facial expression that looks somewhere between confusion and fear, but without any accompanying sound. Older adults in particular may not thrash or move dramatically the way a younger, stronger person might. Reduced muscle strength, arthritis, or simply a lifetime of learning to stay composed in public can mean the physical response is much more subtle. This is why I always tell families, don't wait for drama. Watch for stillness, watch for silence, and watch for that hand moving toward the throat. I think of Harold, 74, at a family barbecue. His grandson noticed him sitting very still, eyes watering, one hand resting lightly at his collar. For a second, everyone assumed he was just overcome with emotion, maybe thinking about his late wife, since that happened sometimes at family gatherings. But something about his stillness felt wrong to his grandson, who had seen a video about this exact sign a few months earlier. He asked Harold directly, "Are you choking?" And Harold, unable to speak, simply nodded. That single moment of recognition changed everything about how quickly the family responded. Now, the final sign. This is the one I never ignore, and it's the most important one we'll talk about today. The fourth sign is what's known as silent choking, and it is a true medical emergency. This is when someone makes no sound at all. No cough, no gasp, no cry for help. They cannot breathe and they cannot speak, because their airway is completely or almost completely blocked. If this continues for more than a few moments, you may notice their lips or fingertips beginning to take on a bluish tint, which happens because the body isn't getting enough oxygen. Their hands will often move instinctively toward their throat, and their eyes will often show clear panic, even though no sound is coming out. I want to be very direct with you here, because this is not a moment for guesswork or home remedies. If you ever witness someone who cannot breathe, cannot cough, cannot speak, and appears to be choking, call emergency services immediately. While waiting for help, if you have training in certified first aid techniques, such as those taught by the American Red Cross or a similar organization, follow that training or the instructions given to you directly by the emergency dispatcher on the phone. I'm not going to walk you through specific physical maneuvers in this video because in a real emergency, hands-on certified training and real-time guidance from professionals matters far more than anything you could learn secondhand from a video. What I want you to take from this video is the ability to recognize that something is seriously wrong quickly so you can get help moving in the right direction without delay. Now let's talk for a moment about why swallowing changes as we get older in the first place, because understanding this can help you and your family be more aware without becoming anxious every time someone coughs at the dinner table. As we age, the muscles involved in swallowing can naturally lose some of their strength and coordination, the same way muscles throughout the rest of the body can. This is sometimes associated with certain neurological conditions, such as a history of stroke or Parkinson's disease, both of which can affect the nerves and muscles responsible for coordinating a safe swallow. Poorly fitting dentures can also play a role because they can change the way someone chews and manages food in their mouth. Dry mouth, which can be a side effect of certain medications, can make swallowing more difficult as well, since saliva plays an important role in forming food into a shape that's easy and safe to swallow. Certain medications themselves, particularly those that cause drowsiness or affect muscle coordination, may also be worth discussing with your physician if swallowing difficulties are a concern. And then there are simply everyday habits. Eating too quickly, taking large bites, or talking while chewing can all increase the chances of food going down the wrong way, regardless of someone's age. None of this means every senior is at risk every time they sit down to eat. Most meals, for most people, are completely safe. But being aware of these contributing factors can help you recognize when it might be worth having a conversation with a physician, particularly if you're noticing a pattern rather than a single isolated moment. I think of my patient Dorothy, 86, who came to see me not because of an emergency, but because her daughter had noticed she seemed to be clearing her throat frequently during meals over several weeks. Nothing dramatic, no blue lips, no silent choking, just a pattern worth paying attention to. When we evaluated her swallowing, we found some mild weakness that was manageable with some simple adjustments to food texture and eating pace. That's often how these things go. Most swallowing changes, when caught early, have manageable, sometimes even simple solutions. And I think of Margaret, 69, and her husband Frank, who told me about a dinner where Frank suddenly went quiet mid-sentence. His face changed, and for about 10 seconds, the whole table froze, unsure what was happening. It resolved on its own. Frank cleared his throat, took a sip of water, and the meal continued. But Margaret told me that moment stuck with her, and it's part of why she wanted her whole family to understand these warning signs, even though that particular evening turned out to be harmless. That's the balance I want to leave you with today. Most of what happens at the dinner table is completely normal. A cough here, a pause there, none of it means an emergency is unfolding. But now you know the 4 signs that matter. A sudden inability to speak while eating, repeated or weak, ineffective coughing during meals, watery eyes, a hand moving to the throat, or an unusually still facial expression. And the most serious of all, silent choking, where there is no sound, no cough, and no ability to breathe or speak, sometimes accompanied by bluish lips if it continues. Many swallowing difficulties have entirely treatable or harmless causes, and there's no need to feel anxious every time you sit down to a meal with someone you love. But if you're noticing a persistent pattern, coughing that keeps happening, a voice that sounds different after eating, or any of the signs we talked about today showing up more than once, that's worth bringing up with your physician. And if you ever witness someone who suddenly cannot breathe, cannot cough, and cannot speak while eating, please don't wait. Call emergency services immediately. I'm Dr. Alan Mercer. Thank you for watching. Take good care of yourself, and I'll see you in the next video.